Please start.
Namaskar, good morning everyone, and welcome to our virtual lecture series, Pharmacological Therapeutic Effects of Top 75 Traditional Ayurvedic Medicine. And today is session 22nd of our series 2. And today's topic is pharmacological and therapeutic effects of Gokshuradi Guggul. And our expert speaker today are Dr. Govind Sharma-ji and Dr. Manjunath Adiga-ji. A very, very warm welcome. Namaskar. And friends, today we have a very special guest on this session, and we are very honored to have Padma Shri Anup Jalota-ji. Welcome, sir. Thank you for joining. And we also have Dr. Ashok K. Nanwani-ji from Amritsar. Welcome, sir. Thank you. Thank you so very much for joining on today's session. And our very special friend and partner in this initiative, Georgie Bhalla-ji. Welcome. And for all our moderator and advisors and host, Harish Verma-ji, namaskar. Thank you all for joining. Friends, as we all know that this initiative, which we took for almost a year and a half, 2 years ago, we have been focusing on that how traditional wisdom of India, which includes yoga, Ayurveda, and meditation, can help in preventative health as well as disease management, curative side of it. And it's an intellectual capital of India, which now taking its own space in the experimental side of it in the Western part of the world. As we all know that a harmony of mind, body, and soul, which we bring through this ancient wisdom. And today we'll learn from Padma Shri Anup Jalota-ji that how music also helps in bringing the positive kind of emotions into human mind. We have been running a series on mental health. Recently, we concluded a mission to India in which we took Minister for the Mental Health and Addiction to India, that how this ancient wisdom can help into the mental health side of it. And as you all know also that in June, we are also partnering with a National Congress Healthcare Summit in which we are taking a special session on Ayurveda on the mental health aspect of it. So we all are working together, learning every alternate week. It's a ritual which is brings us knowledge and wisdom to our life. And we are very, very especially thankful to all our speakers from time to time who comes and share with us all their knowledge and wisdom. With that note, I would like now request Harish Verma-ji to please begin the session. Harish-ji, over to you.
Thank you, CG. Thank you very much. Good morning, friends in Canada and US, and good afternoon in UK and Europe, and good evening in India. Welcome to 22nd session of virtual lecture series on pharmacological and therapeutic effects of top 75 traditional Ayurvedic medicines. Friends, we are running this virtual series with the help of Canada-India Foundation, Toronto, Consulate General of India in Toronto, Ayurvedic Association of Ayurvedic Practitioners in Canada, and Ayurveda Union of Midwest Chicago, European Ayurveda Association Germany, Association of Ayurveda Academy UK, International Ayurveda League, Mumbai, Tathastu, US, and our media partners in Europe, UK, Canada, and US. Today's topic is pharmacological and therapeutic effects of Gokshuradi Guggul. Gokshuradi Guggul is a polyherbal traditional Ayurvedic medicine which is commonly used for various genitourinary disorders, including urolithiasis, means kidney stones or urinary stones, urinary incontinence, prostate enlargement, and many other disorders. In one clinical study, Gokshuradi Guggul has been found very effective for those patients who are having diabetic nephropathy. This is very important, and we will learn today from our speakers. We have two speakers, expert speakers, Dr. Govind Sharma, who is a BMS MD and working as Associate Professor of Ras Shastra and Bheshaj Kalpana at SDM College of Ayurveda, Hassan, Karnataka in India. He has published many research papers, research articles in peer-reviewed journals, and given many presentations in different seminars and workshops. He is a guide for postgraduate students. He is a recipient of Dr. Virender Hegde Pattabhishek Award of Academic Excellence. Welcome, Dr. Govind Sharma ji. And friends, we have other speaker, Dr. Manjunath Adiga, who is a BMS MD in Ayurveda and working as Professor of Kaya Chikitsa at SKS Ayurveda Medical College and Hospital in Bangalore. He got good clinical experience in managing pathological conditions at SDM College of Ayurveda at Hassan. He gave many radio talks on diabetes and skin disorders and shared health tips on different conditions at All India Radio Hassan. Welcome, sir. And both speakers will enlighten us about pharmacological and therapeutic effects of Gokshuradi Guggul and will share their experience. And friends, today we have two special guests, Padam Shri Anup ji, who is a Bhajan Samrat. As Thesis ji has already mentioned, we will ask Anup ji his experience, how music can help in mental health issues. And today we have another very special guest in our technical session, Dr. Ashok Nandwani ji. He is my teacher, my mentor, and my guru. He is a professor at Ayurvedic College in Amritsar. He is a professor of Kaya Chikitsa. I learned from him. I was a student. When I was his student, I learned from him how to integrate allopathic and Ayurvedic system of medicine in clinical practice. He taught us how to diagnose disease with the modern medicine and how to treat the patients with the Ayurvedic principles and Ayurvedic system of medicines. And with this integrated system, I practiced in India for 25 years. And today we will learn from Dr. Nandwani ji why it is important to integrate both medical systems, Ayurvedic system and modern system of medicine, and why it is important and what are the benefits of integration of both the systems. And today we have Dr. Madan Thangavelu with us. He is a genome scientist from Cambridge, UK. Dr. Madan ji is a scientist of modern medicine and having vast knowledge of Ayurveda. He will moderate the session today. And so without wasting any time further, I would like to invite Dr. Madan Thangavelu ji. Dr. Madan Thangavelu ji, over to you.
Harish ji, namaskar. Thank you again, Satish ji, namaskar. Thanks for bringing us all together once again on this exciting journey as we go through hopefully 75 to 100 or perhaps even more traditional Ayurvedic medicines. The challenge here is time. Of course, we have only 90 minutes to go through the program. And in that space, we have a fantastic learning experience here. Traditional Ayurvedic medicines are medicines that are sometimes very complex formulations. And we will hear about one of these today. Gokshuradi Guggul contains two main ingredients, Gokshur and Guggul. Our learned speakers will tell us a little more about this. Now, a question that is always asked is why we use complex formulations. And hopefully we can learn about this from Professor Ashok Nandwaniji as we go through the program, and also from our speakers. But before I give the floor to our special guests and the first speaker, I just want to share a little bit about how people are understanding these complex formulations and where we might end up with time, and whether that final goal will help us learn any better about these complex formulations. I don't know, but it might be a while before we get to it. The first is a paper that comes from Romania. And here you can see the abstract of this paper. I'll put it up on the screen very quickly. It's a review of the phytochemical, pharmacological, toxicological properties of Tribulus terrestris, which is Gokshur. And this comes from a very important university named after a very, very important person, George Emil Palade. Now, he's a Nobel Prize winner, born in Romania, and he gave us deep insights into the biology of cells. So we want to thank Romania for taking on this challenge of understanding this plant and how it works. The second one is a paper that comes from India, from the Manipal Academy of Higher Education here, and a second one, an Ayurveda college from the Department of Dravya Guna at the Munial Institute of Ayurveda and Medical Sciences. Once again, I want to just very briefly highlight how they are trying to uncover Tribulus and how it works against cardiac diseases. I will leave this up on the screen so that people who are interested can make a quick note of these two papers. And as Satish ji mentioned earlier, in June, we will be discussing all these things at the Third World Congress for that will be held in Toronto. And many of these points will appear in our discussions. And hopefully with time, as we progress, we will learn a little more on how to use this. Satish ji, we are progressing with our speakers, and perhaps we will come to Dr. Nandwani towards the end of our discussions. I think that might be the best way so that he can comment on the presentations and also on where we should be going ahead with these kind of discussions and deliberations. I take this opportunity to invite Dr. Govind Sharma. Govindji, namaskar. Thank you so much for joining us from Hassan in Karnataka. We are delighted to have you here with us today. Do enlighten us on this formulation, a very important formulation that has all kinds of activities. It has antibacterial activity, it has anti-inflammatory activity, and perhaps much, much more that awaits discovery. All of this knowledge is hidden away in the deep Ayurvedic texts, mostly written in Sanskrit, which we will hear from Dr. Manjunath, our second speaker, about the challenges of understanding Sanskrit texts. But from yourself, Govindji, we want to hear a little bit very quickly on how this formulation is put together and what are the ingredients, etc. But before you start, Govindji, a question that is always asked in our floor is from the young participants who want to know why you came into Ayurveda. And perhaps very briefly, you can tell us, for those who haven't been to SDM, to Hassan, SDM Hassan is one of the most beautiful campuses. Their college is very privileged to have the patronage of a very, very important person from Karnataka. The question for you, Govindji, before you go on to your presentation, what brought you into Ayurveda? And what gives you this confidence to continue with it every day? Welcome to the platform, Ji.
Yes. Namaste, sir. Hope I'm audible.
We can hear you clearly. Thank you, Ji.
Yeah. So before starting my presentation as such, I feel privileged to share this online platform with the likes of Padma Shri Anup Jalota ji and all learned Ayurveda speakers, respected Satish Thakkarji, most respected Madan Tangaveluji, Harish Verma sir, and my co-speaker Dr. Manjunath Adiga. Good evening to all of you and all other listeners who are online. Before starting my presentation, Madan Tangavelu sir have put a very tricky question in front of me as to why I have joined Ayurveda. Well, after completion of my +2, after PUC in India, we take up medical or technical field of education. So I wanted to become a medical professional, and in my place, I am basically from a place called as Kasargodu, which is in Kerala. Probably all of you are aware that Ayurveda is very much familiar in Kerala, and it is in tradition. Practice Ayurveda is there in Kerala. So we have seen so many Ayurveda practitioners in and around my place, and our family doctor was an Ayurvedic physician. So probably I wanted to do a medical science, and probably this inspired us to join Ayurveda. And fortunately, I could join SDM College of Ayurveda and Hospital, which is situated in a place called as Hassan, which is equidistant from Bengaluru and Mangaluru. Probably now this place is known because of SDM College of Ayurveda across the world. And we have a 40 acres green campus with the post-graduation studies in almost all specialty of Ayurveda. And we also have a PhD courses in 6 disciplines of Ayurveda. And we have a 360-bedded hospital, which takes care of almost all specialties, including psychiatry, pediatrics, gynecology, and other systems of Ayurvedic medicine. So this is about why I came to Ayurveda. Tangaveluji.
Thank you, Ji. Thank you. For listeners who are here, might also want to know that Hassan is the town where the Indian Space Research Organization has their master control facility. Thank you, Ji.
Yeah. Can I continue with my presentation?
Please.
Yeah. I will be able to share my slides?
Please, yes. You'll be able to share your... If there's a problem, I can share it from here, but you should be able to do it yourself.
Okay, sir. 1 minute.
Govinji, while you're putting your slides up, could you also tell our speakers how many students you have there in college at any one time? That includes the whole student body. Is it about 1,000 or 1,500?
It's almost around 1,000 now, because we have average intake of 100 students for undergraduate studies, where BAMS course is conducted for 5.5 years, where 4.5 years will be
Dr. Madanji,
Anoopji
is going after 5 minutes. Can we have him first?
Anoopji, namaskar. Okay,
Namaskar.
Stay with us while you upload your presentation. We are delighted to have Anoopji. Anoopji, namaskar. बहुत धन्यवाद जी. Thank you.
बीच में यहाँ से नेटवर्क चला गया था, वाईफाई छोटे सिटी में हूँ, लेकिन अब फिर पहुंच गया. फरमाएं. अब हम कुछ और आपको बताना चाहते थे.
We are very happy to have you here with us. अगर हिंदी में बात करनी चाहिए तो हिंदी में कर लो जी. अगर अंग्रेजी में करना हो, whichever you choose, we are delighted to have you here with us. And you're joining us.
तो पंजाबी जी कर लीजिए.
पंजाबी भी बिल्कुल जी.
सारा टब्बर ही पंजाबी होता है आजकल. जितने जाओ.
You can talk English, you can talk Sanskrit, you can talk in many languages.
But we are so happy to have you here with us, sir. Before we went on screen, you were telling us कि Hindustan's contribution for global health. And this is a very, very important place that India is occupying, and we can do much more. And you are experienced in one of the subtle areas of how music can be used to heal people. We look forward to hearing from you. Perhaps Satish ji would like to say a word or two. Satish ji, namaskar.
Yeah, sure, Satish.
First of all, Anup ji, very, very warm welcome. We are deeply honored to have you. Your service to the humanity for over half a century through music has been commendable, and we all have grown up listening to your soulful music, devotional bhajans, apna ghazals and other music. So Anup ji, through this initiative, we are focusing on mental health a lot. And we recently concluded a trip to India where we took Minister for the Mental Health and Addiction to India to give first-hand experience that how yoga, Ayurveda, meditation, all that can help into the mental health side of it. And same way, Indian music has been I would say a foundation which is also very, very soulful, and its roots comes from our Vedas. So your thoughts and please share your wisdom and thoughts that how music plays its own part into the overall health of the human being.
देखिए, म्यूजिक ने मुझे जो हेल्प किया है पहले मैं वो बताता हूँ। मैं अब 70 वर्ष का हुआ, आई एम 70, और मैं फील करता हूं कि आई एम 35। जिस तरह से मैं काम करता हूं, आई गिव माई कॉन्सर्ट 20 cities in a month. So I travel 20 cities, means I take 40 flights. मैं कितना ट्रैवल करता हूं, अब जरा सोचिए आप कि मैं कहां से कनेक्टिंग फ्लाइट, कहां से ट्रेन, लेकिन 20 cities में ट्रैवल करता हूं, और वहां सिर्फ ट्रैवल नहीं करता हूं, वहां जाके 2-2.5 घंटे का कॉन्सर्ट भी देता हूं। ये सब तभी पॉसिबल है जब आपका बॉडी, माइंड और सोल तीनों मिलके काम कर रहा। अगर सिर्फ बॉडी काम कर रही है तो माइंड थक जाएगा, आपका सोल आपकी साथ नहीं देगी। तो आपको तीनों को मिला के काम करना है। इसीलिए हम लोग कहते हैं कि आदमी जो भी काम करे, सपोज कोई डॉक्टर है, डॉक्टर ने अगर अपने काम में स्पिरिचुअल टच दे दिया है, वो अपने काम में स्पिरिचुअलिटी को साथ में रख के करता है, तो वो काम बहुत अच्छा होगा और वो देर तक इस क्षेत्र में काम करता रहेगा। मैं लोगों को यही समझाता हूं कि आप कुछ भी करिए। हम म्यूजिक जब सिखाते हैं तो हम म्यूजिक सिखा के लोगों को ये कहते हैं कि आप अच्छे मटेरियल बनिए। आप केवल अच्छे गजल सिंगर मत बनिए, केवल भजन सिंगर मत बनिए, आप केवल एक फोक सिंगर मत बनिए, आप अच्छे मटेरियल बन जाइए। वंस यू आर अ गुड मटेरियल, तो उस मटेरियल का हम कुर्ता भी बना सकते हैं, उसकी हम एक शॉल बना सकते हैं, उसकी पैंट भी बन जाएगी, उसकी साड़ी भी बन जाएगी, उसकी सलवार भी बन जाएगी, क्योंकि वो मटेरियल अच्छा है। अगर वो मटेरियल ठीक नहीं है तो आप जो कुछ भी बनाएंगे वो फट जाएगा 2-4 दिन चल के। तो हमें अच्छा मटेरियल बना, और अच्छा मटेरियल तभी बनेगा जब हम इन तीनों चीजों को शक्तिशाली बनाएंगे, जो है बॉडी, जो है माइंड, जो है सोल। तो हम ये अपने सारे स्टूडेंट्स को ये सिखाते हैं। मैं रोज कितने ही लोगों को सिखाता हूँ और उन लोगों को यही बात बताता हूँ कि यार सिर्फ डोले शोले बनाने के लिए तुम लोग जिम में मत जाओ, वो तो घर में भी बन जाएंगे, लेकिन बाकी चीजें तो जरूरी हैं। उसके लिए तुम योगासन करो, प्राणायाम करो, अच्छी जो योगासन की विधियां हैं वो करो, जल नीति करो, कुंजल करो। ये सब मैं आज रोज करता हूँ। मैं जल नीति रोज करता हूँ सुबह, मैं कुंजल करता हूँ, और ये पिछले 55 साल से करता हूँ, अभी नहीं। तो ये करने से वो शक्ति बनी रहेगी जो आज भी लोग मुझे आश्चर्य होते हैं मेरा गाना सुन के कि वो जो लंबी सांस आप लेते हैं इतनी लंबी, वो कैसे संभव है। मैंने कहा वो इसी तरह संभव है। आप प्राणायाम करते रहे, आपके जो लंग्स हैं वो लंग्स पूरे खुले, आप अपने पूरे लंग्स इस्तेमाल करते ही नहीं। जब हम फुटबॉल का कोई ब्लैडर है उसको फुलाते हैं, तो जब तक वो पूरा नहीं फूल जाता है हम उसमें हवा डालते रहते हैं। वही लंग्स का मामला है कि लंग्स जब पूरी तरह खुलेंगे तभी तो वो यूज होंगे ना, पूरा नहीं तो चिपके रह जाते हैं। लंग्स भी पूरे खुलते नहीं। जब हम पूरी सांस लेते हैं, अब हमने इसको पूरा खोल लिया, अब इसको धीरे धीरे छोड़िए, फिर खींचिए, फिर धीरे धीरे छोड़िए। तो आपने इसको पूरा इस्तेमाल किया। पूरा इस्तेमाल ही नहीं करेंगे तो फिर वो लंग पूरे खुलेंगे कैसे? तो मैं मजाक में लोगों को कहता हूं कि भाई दो चीजों पे कंट्रोल बहुत जरूरी है जीवन में। एक तो अपनी सांस पे, आपकी सांस जो है वो बहुत सही हो, और दूसरी अपनी सांस पे भी कंट्रोल जरूरी है। तो ये दोनों चीजों पे आप कंट्रोल कर लीजिए, आपका जीवन जो जॉर्जी ने किया हुआ, जॉर्जी ने बहुत बढ़िया कंट्रोल किया। उन्होंने सास पे भी किया हुआ, सास की बेटी पे भी किया हुआ, बहुत बढ़िया कंट्रोल। तो अगर ये कंट्रोल हो जाए तो इंसान हेल्दी रहता है, जीवन भर हेल्दी रहता है। यही मैं अपने संगीत के स्टूडेंट्स को सिखाता हूँ, यही मैं अपनी ऑडियंस को बताता हूँ। और यही कारण है कि ऑडियंस फिर चिपकी बैठी रहती है। अगर मैं 2 घंटे गा रहा हूँ तो 2 घंटे वो चुपचाप बैठ के सुनते हैं, वो ग्रहण करते हैं, वो सिर्फ कान तक नहीं ले जाते, उसको हृदय तक ले जाते हैं। हृदय में जाके वो समाहित होता है और उनका जीवन सुंदर होता है। यही बातें हम लोगों को आज यहाँ बहुत अच्छा डिस्कशन करने को गैदर कर रही है कि हम अपनी बॉडी को, अपनी हेल्थ को, मेंटल हेल्थ को कैसे अच्छा करें। तो संगीत के माध्यम से इस तरह से हम अपने हेल्थ को अच्छा कर सकते
हैं। अनूप जी नमस्कार। अनूप जी, मुझे पता है कि आप कॉन्सर्ट में बिजी हैं, तो जाने से पहले 2 लाइन थोड़े एक भजन की सुना दीजिए।
अच्छा, भजन भी सुना देता हूँ। उसके पहले मैं आपको एक जोक सुनाता हूँ बहुत अच्छा
जी।
आज मुझे एक आदमी मिला, तो मैंने उसे पूछा भाई तुम्हारा नाम क्या है? तो उसने कहा मेरा नाम है मिर्ची कृष्णा। मैंने कहा यार ये क्या नाम हुआ मिर्ची कृष्णा? तो उसने कहा क्यों, अगर हल्दी राम हो सकता है तो मिर्ची कृष्णा भी हो सकता है। अच्छा
अनूप जी,
देखिए,
हमारी तरफ से एक छोटा सा सवाल जी।
जी हाँ, जी हाँ।
बच्चों की तरफ कैसे ले जाएं जी? आपने जो बताया ये छोटी छोटी चीज, जल मेथी और इस टाइप की चीज, यहाँ काफी लोग पूछ रहे हैं कि बच्चों की तरफ कैसे ले जाएं इस टाइप का।
बच्चों की तरफ ऐसे ले जाएंगे कि जो कुछ ऐसे हमारे म्यूजिक के कंपोजिशंस हैं जो बच्चों को बड़े अच्छे लगते हैं। देखिए हमारे पास एक बच्चा बैठा गा रहा है, ये देखिए,
नमस्ते।
इसकी आयु देखिए और इसका गाना सुनिए। सारे गा रे सा, गा रे सा, सारे गा रे सा नी सा रे गा, अच्युतम केशवम कृष्ण दामोदरम राम नारायणम जानकी वल्लभम। देखिए आपके सामने मैंने सुना दिया। प्रैक्टिकल सामने कि ये मैं करता हूँ। ये बच्चे दिन में घर में हमारा गाना सुनते हैं, सोशल मीडिया पे सुनते हैं, यूट्यूब में सुनते हैं और अपने को ऐसा बनाते हैं। तो इस तरह से हम जगह जगह, गांव गांव जाए। देखिए बलिया में यहाँ बैठे हैं काम कर रहे हैं, बंबई में नहीं बैठे हैं, छोटे से गांव में बैठ के काम कर रहे हैं। तो इस तरह न जाने कितने बच्चे आते हैं, मिलते हैं। तो इस तरह से हम इनको संगीत की जो शिक्षा देते हैं, संगीत की रुचि पैदा करते हैं। वो इंटरेस्टिंग, ऐसी लागी लगन सबको याद है। चलो एक लाइन सुनाओ, ऐसी लागी लगन। ऐसी लागी लगन, ऐसी लागी लगन, मीरा हो गई मगन, वो तो गली गली हरि गुण गाने लगी, हरि गुण गाने। तो ये हमें करना है कि इनके अंदर इसकी रुचि, इसका प्यार पैदा हो, और वो हो रहा है। तथास्तु यही मदद कर रहा है, तथास्तु पूरे संसार में इस क्षेत्र में काम कर रहा है।
हरीश जी की सवाल जी, हरीश जी की।
बस अनूप जी 2 लाइनें सुना दीजिए, फिर देन वी विल स्टार्ट।
सुनिए।
जी जी।
जग में सुंदर है दो नाम, चाहे कृष्ण कहो या राम, बोलो राम राम राम, बोलो श्याम श्याम श्याम। एक राधिका के संग राजे, एक जानकी संग विराजे, चाहे सीता राम कहो या बोलो राधे श्याम, चाहे कृष्ण कहो या राम। धन्यवाद।
Before
मेरा भी कार्यक्रम शुरू होने जा रहा है, तो मैं भी अपने कार्यक्रम को ज्वाइन करता हूँ। तो मेरी ऑडियंस बैठी वेट कर रही है, और आप लोग अपने कंटिन्यू रखें डिस्कशन, और हम जल्दी फिर मिलेंगे।
Really appreciate.
बहुत बहुत धन्यवाद, बहुत बहुत धन्यवाद अनूप जी।
Brother, you would like to say a few words before Anup ji goes?
No, I just wanted to thank him. You know, it was very kind of him. He actually waited for us and stopped the concert in between because of our set timings. And Anup ji, I'm really, really, really very thankful to you for this. Although I had a set.
आपसे बड़ा डरता हूँ जॉर्जी जी, मैं क्या
अरे क्या बात है, क्या बात है। Although I had
धन्यवाद।
Anup ji, we are looking forward to your trip to Canada and US sometime soon.
July, definitely.
July में, yeah.
We are there.
जी।
नमस्कार जी।
नमस्कार।
Thank you.
नमस्कार, नमस्ते जी, बहुत बहुत धन्यवाद।
Professor Sharma, apologies, apologies we got, because as you saw, Anup ji has started a concert there in Balia, border between Uttar Pradesh and Bihar. Now, floor is yours, sir. I hope you have your presentation in place, and enlighten us on these two, on this amazing formulation. And perhaps before you conclude your presentation, also very quickly, what an exciting result that you had using this formulation, very, very swiftly, while we. So for those listening to us, as Professor Sharma mentioned, the college has over 1,000 students, including undergraduates and postgraduates. Not many people know that in India, we have such a large number of these colleges with students ranging around those kind of numbers. Are you able to share your screen, Dr. Sharma? Oh, there we are. Thank you.
Yeah. So I hope this screen is visible.
The screen is visible?
Yeah.
If you can scale it down a little bit, it seems. You might want to scale the. Please proceed, Dr. Sharma. There's some difficulty with.
Yeah, I think there is some problem with this scaling of the screen.
We can still see. Oh.
Is it okay now, sir?
That's fine. Let's proceed. Thank you.
Yeah.
Fine.
Good evening, everybody. Once again, thank you, and feel privileged to share the dais with the likes of Padma Shri Anup Jalota ji. And now let us continue with our discussion on Gokshuradi Guggul, a wonderful formulation of Ayurveda. It is a polyherbal formulation which contains around 9 ingredients, including Gokshura and Guggulu. And let us start our presentation. Guggulu is a gum or resinous material exudated from the plant called as Commiphora mukul. As a plant grows in dry or hilly regions, and as a plant grows, the twigs and the bark starts exuding a resin, or whenever the plant or bark gets injured the resinous material gets exudated, and that resinous material is being collected, and it is purified with different methodologies, and then it is used as a medicine. Guggulu, as a single drug itself, is useful in treatment of various disorders in Ayurveda. Especially, it is considered as a lekhana dravya, which can scrape out excessive body tissues, unwanted adipose tissues, and other things. And it is also considered as vatahara, which can reduce the pain and inflammation in the joints. So guggulu has been given much importance in Ayurveda, and there is separate dosage forms in Ayurveda called as guggulu kalpana. Kalpana means the formulation. So various formulations that can be prepared by using guggulu are considered as a guggulu kalpana. And many of the formulations are in pill form or tablet form, where as we know that most of the tablets which we prepare require one or the other binding agent as another excipient that is required to bind other materials or the pharmacological active principle. Guggulu has an advantage that it being one of the pharmacological ingredient which has its own therapeutic efficacy. Apart from that, it also acts as a binding agent. That is why Ayurvedic formulations containing guggulu have been given much importance. So guggulu as an individual drug also can be used in the therapeutics. Apart from that, guggulu can be used as one of the ingredient in many other formulations. So one of the advantages in this guggulu is, in Ayurveda we call it as yogavahi property. Yogavahi property refers to a property where the drug will have its pharmacological activities intact. At the same time, other ingredients which are added as an additive with this guggulu, it will also act as effect modifier. So that is why guggulu kalpana are much praised in Ayurveda for treatment of various disorders. So guggulu being vatahara, like useful in pain, inflammation, and which can treat lipid disorders. Apart from that, whenever it is being used with other ingredient, it will also carry forward other effects of other ingredients also. The same thing has happened in Gokshuradi Guggul, which we are going to discuss today. Gokshura is one of the drug, as Professor Thangavelu sir was telling, it is one of the very good diuretic drug. So this guggulu, when it is mixed with the Gokshura guggulu, Gokshura Adi means there are some few more ingredients that are added, which is termed as Adi in Ayurveda. So Gokshuradi Guggul takes care of the urinary tract disorders, including diabetes mellitus. So this is a textual reference. This quotation is in Sanskrit. So I'm not going to read this quotation, but I just wanted to show you that this quotation is from a very famous textbook called as Sharangadhara Samhita, which is considered as most authoritative book for pharmaceutics in Ayurveda. Most of the formulations that are available in Ayurveda, they are prepared as per the descriptions available in this particular text called as Sharangadhara Samhita. So this the Sanskrit quotation, which was there in the previous slide, has been given in English here for your reference. You can see that it has only these 9 ingredients in total. Gokshura is called as Tribulus terrestris in scientific world, is the maximum content. In Ayurveda, it is taken in a ratio of 28 pala, which almost becomes equal to 1.344 kg. So this is a ratio, proportion that is given for Gokshuradi Guggul. We can by either like reduce this by 50%, 25%, 10%, or multiply by like 2 times, 4 times, 6 times, 8 times. And we can, depending upon the batch of the tablets or pills which we require, we can increase or like reduce the scale of the ingredients. But this is a proportion with which the ingredients have to be taken in this formulation. Gokshura is 1.344 kg, and Guggulu, that is Commiphora mukul, I have specified it here. It has Shuddha Guggulu. We will go through about the process of Shodhana later slides. It has to be taken in the quantity of 336 grams when we have taken 1.344 kg of Gokshura. And we have seven other ingredients, which are like called as Triphala and Trikatu, very famous like drugs in Ayurveda. Trikatu refers to 3 drugs which are having katu rasa, the pungent taste. They are highly potent drugs, and they are considered as Ushna and Tikshna in Ayurveda, and they are Pittakara, that which aggravates or increases Pitta and reduces Kapha in the body. So they are taken in the quantity of 48 grams each, which is called as 1 phala. Next, we have 3 fruits which are considered as 3 phala. Very famous fruits of Emblica officinalis, Terminalia, Cebula, and Terminalia bellerica, called as Amalaki, Haritaki, and Vibhitaki, are taken in again the quantity similar to that of Trikatu, 48 grams each. And we have one tuber called as Musta, which is called as Cyprus rotunus in scientific language, is taken in a quantity of 1 phala again. So these 7 drugs are taken in a quantity of 48 grams each, and Shuddha Guggulu and Gokshura are taken as specified in the slide. And we'll just go through the ingredients again, because most of you probably are not aware with these ingredients. That is why I just wanted to post the photographs of these ingredients. And Gokshura, you can see a small shrub which is having thorny fruits-like structure, which are collected in a bowl there in the left-hand side, the bottom. They are called as Gokshura, a very wonderful drug which is having diuretic effect. And I also have shown 2 glass beakers, with one with water, other with a decoction of Gokshura. We have prepared this formulation as a trial basis just to show you how to prepare this Gokshuradi Guggul. So Gokshura have to be taken, added with water, and then it is boiled on fire to prepare a decoction. And then this decoction is used as a base to continue the procedure. Next, we have Guggulu. As I was telling in the introduction, you can just see the photograph of a plant of Guggulu, which is a medium-sized tree with the resinous exudations from the barks. On the right-hand top side, we can see a resinous mass. I have just encircled it with a yellow circle just to make you drag your attention to that particular the picture. And that resinous exudation is collected, which is on the right-hand side bottom, which is called as resinous mass called as Guggulu. This Guggulu, which is there, vitreous translucent mass which is seen, it is Ashuddha Guggulu. As we collect it, it may have like pieces of wood, pieces of leaflets of this particular plant, and sometimes that gum may fall down on the ground, and the collectors may collect it, which may contain little mud and stones. That is why it is mandatory that it should be purified with different methodologies that are available. So we'll brief the methodology of purification also later. And the left-hand side bottom, the black colored mass which we see is a Shodhita Guggulu, which has been purified with the methods as advocated in Ayurvedic literatures. And these are 3 pungent materials which are called as Trikatu. For the first one, left-hand side, the top is a plant of Zingiber officinalis, and the tuber of that is collected and used as the raw material for the preparation. It is called a shunti in Ayurveda, Zingiber officinalis, dried tuber of Zingiber officinalis. The second middle one is called as Pipili, the Piper longum, and the fruit is collected and dried, which is shown in the red bowl kept in the center. The last right-hand side, which we see, is probably all of you have seen this drug. All of you are aware because it is used as one of the spices in the kitchen, and it is called as maricha or Piper nigrum. The seeds of maricha are collected and dried. So the dried material of tuber of shunti, Zingiber officinalis, fruits of Piper nigrum and Piper longum are called as Trikatu. These are taken, powdered, and are added to the preparation later. This is again famous fruits called as Triphala. The Umbilica officinalis, the fruit is collected, the seed is removed, and the outer flesh is dried and is collected, is called as Amalaki, Umbilica officinalis. The second one is Vibhitaki, Terminalia bellerica. Even here also fruit is collected, and the fruit is broken into pieces, and the seed is removed. And same is the case with the Haritaki, the third one, Terminalia cebula. The fruit is collected, dried, and the seed is removed and used in the preparation. The last ingredient in the formulation is Musta, You can see it's a small grass type herb. It's called Cyprus rotundus in the scientific language. And again, I have marked a yellow circle to this particular the diagram picture, just to denote that the tubers are collected from that area and dried. And the right hand side in the bowl, you can see the dried musta, which is used as an ingredient in the preparation. Now, let me, before starting the preparation of Gokshuradi Guggulu, I just told you that Guggulu may have a lot of physical impurities in the form of stone, mud, or pieces of wood, which has to be purified. So if we do not want any pharmacological action of the drug which is required for Shodhana, then we can purify it with simply water. Water is also used as a method of the solvent to dissolve this gum into that and filtered repeatedly with the cloth and then dehydrated again to collect Shuddha Guggulu. But in Ayurveda, most of the times what we do is we use some other agent which has also have some therapeutic action. So in this case, I have shown you the photograph of Guggulu Shodhana with the Gomutra. The cow's urine is used as a media in which the collected Guggulu is totally dissolved. After maybe it takes 2 to 3 hours to totally dissolve this total gummy resinous material into the Gomutra, and then it is repeatedly filtered with a clean cloth. And then it is dehydrated again and all water content is evaporated. And after evaporation, the gummy material will be regained back, which is called as Shodhita Guggulu. This is one of the methods that is adopted to do Shodhana Guggulu. As I just told you, there are different methods by which we can do Guggulu Shodhana. And here we have a list of around 13 different solvents with which we can do Guggulu Shodhana. It may be the decoction prepared with the Tinospora cordifolia, which is called as Guduchi Kwata. Or again, we can use the 3 myrobalans like Trifla, Amlaki, Haritaki, and Vibhitaki. The Kwata decoction of that can be prepared and it can be used as a media to dissolve Guggulu and do Guggulu Shodhana. And these are the various solvents that can be used. And you can see at the last, in the 13th number, we also have water. As I told you, if you do not want any therapeutic action of the solvent that is used, then we can use water. In all other cases, the solvent which we have used for Shodhana of Guggulu also acts as one of the modifier of the effect of Guggulu. Just to brief you, I'll tell you one example of a research done on Shodhana of Guggulu using Trifla Kwata and Shodhana of Guggulu done using Gomutra. And after that Guggulu was used on the patients to see the lipid lowering action of this Guggulu. And it was seen that the Guggulu that is purified using Gomutra is more efficacious in treating lipid diseases than the Guggulu that is purified using Trifla Kwata. This is one of the examples just to explain you as to how the pharmacological action of Guggulu may be altered by using different medias for Shodhana. So in preparation of Gokshuradi Guggulu, usually we use either Trifla Kwata, Guduchi Kwata, or the Gomutra as a medium of Shodhana, because it may help in the final pharmacological action of Gokshuradi Guggulu. So after purification of Guggulu, the Shuddha Guggulu have to be used for further process in the preparation of Gokshuradi Guggulu. Please read GG as Gokshuradi Guggulu. So we have seen all the 9 ingredients and their photographs and the usual parts that have to be used in the preparation. So we have to take the thorns of Gokshura, collect it as per the ratio that has been given in the classical references, make a coarse powder of the drug, and then add it with the potable water or drinkable water. And it is advised in the references that 6 times water have to be added, dissolve and boil this Gokshura on mild flame and reduce it to half. And then it is filtered with the clean cloth, and that is called as Gokshura Kwatha in Ayurveda, the decoction prepared from Gokshura. And that decoction is used to dissolve Guggulu again. The Shuddha Guggulu that has been obtained by the previous methodology of Shodhana have to be added to this decoction and again dissolved completely. And if in case required, we can filter it again, or otherwise we can continue with the further process of heating the decoction in which Guggulu has been dissolved on mild flame again. And there are certain features mentioned in Ayurveda that the total in the beginning of the procedure, what happens is it will be like a liquid. The guggulu and the decoction of Gokshura will be like a liquid. And as we go on heating it on mild fire, it goes on thickening and it becomes like honey. And there are certain tests which we have to do, like we just put a drop of that into 1 cup of water, and it, without like floating much or without spreading on the surface, it slowly starts what I call like sedimenting into the bottom of the water. That is another test which is done. Like that, there are different tests that have been advocated for identifying the test of perfection in Ayurveda. That is called as Gudapak Lakshana. And once the feature is obtained, we have to add the fine powders of 7 drugs like Triphala, Trikatu, and Musta, and continuously stir it becomes a homogeneous consistency, and then it is rolled into the pills. Now I have a small video of preparation of this Gokshuradi Guggul. It is hardly 2 to 3 minutes. Please have a look into this, that we have taken Gokshura and then pounded that Gokshura into coarse powder, added with water, and we have prepared a decoction. Added 6 times water and reduced 1/2. Then to that this guggulu is added and dissolved, and it is stirred on mild fire till it attains a particular consistency, which is advocated as Gudapaka Lakshana. And now that has reached. In this picture, you can see that the Gudapaka Lakshana has reached. Now we have taken the 7 drugs, Trikatu. This is Amalaki, Haritaki, and Vibhitaki, that is Triphala. And Musta. The powders of all these Trikatu, Triphala, and Musta are slowly added to that material that is cooked on fire, and it is stirred well to make a homogeneous mixture. And you can also see that it is blended well to make a homogeneous mass. The mass is ready now. This should be the consistency of the preparation, intermediate preparation. Now, this is called as pill roller and pill cutter. The manually, traditional way in Ayurveda, prepare pills by using this machine called as pill roller and pill cutter. So we have made a thread of uniform size, and it is rolled into a pill cutter. This is just to have a uniform dosage. So if you roll by bare hands, there may be variation in the dosage. With the help of that machinery, we have made it into small pieces. Now it is rolled to get round pills, which are ready to be used. Now we have to just dry them, and after drying, you can see that this is the consistency of the tablets that have been prepared. This is a traditional way of preparation for small scale manufacturing. And in large scale, maybe different other technologies may be used. Just for demonstration purpose, I have included this small video for your reference. And after preparation of this Gokshuradi Guggul, it has to be used in a dose of 3 grams. In divided as 3 grams per a dose. And in a day, we can go up to 12 grams per day. And with the different adjuvants, depending upon the therapeutic efficacy that is required, the clinicians use different we call as anupana, which is used as an adjuvant along with the tablet or the pills. These are the classical indications that are given on the left hand side of this slide. Prameha, Mutrakritra, Mutragata, Vatarakta, Vataroga, Shukraroga, and Ashmari. These are the indications that are given in classical Ayurvedic literatures with the different adjuvants when we use this Gokshuradi Guggul, because of the blend of pharmacological activity of different ingredients that are added in this preparation. It will be useful in all these conditions. Just for making the other scientists of other branch who are there other than Ayurveda, just to make them aware about the action of this particular formulation, it is given on the right hand side that this particular formulation is anti-inflammatory, analgesic, antibacterial, and useful in the conditions like gout, renal calculi, urinary tract infection, chronic kidney diseases, and also benign prostatic hypertrophy, which is called as Ashtila in Ayurveda. And just analyzing the proportions of ingredients, we have 9 ingredients in this particular preparation, out of which 80%, almost 80%, is Gokshura and Guggulu. That is why probably this is named as Gokshuradi Guggul. Gokshura is 66%, almost 66.66. Guggulu is 16.66. And other ingredients which are added are 2.38% each: Amalaki, Haritaki, Vibhitaki, Trigatu, and Musta. And after analyzing their pharmacological actions in Ayurveda, we see that the left-hand side, which is given, is name of the drug. The middle column we have given the pharmacological properties as per Ayurveda. It speaks about the taste of the drug. Gokshura is Madhura Rasa. That is why it acts on Vata and Kapha. Guggulu is Katu and Tikta Rasa. That's why it acts on Vata. Shunti is Katu Rasa. It acts on Vata and Kapha. Like this, you can see that in the column in the middle, most of the drugs are having Katu, Tikta, and maybe Madhura and Kashaya Rasa. And overall, their action will be on Vata and Kapha. And Guggulu as such is actually a Pitta Kara drug. That is why most of the diseases in which Vata and Kapha is involved, this particular formulation can be used. And most of the indications which we have seen, like the calculus, if we see, as per Ayurveda, calculus is generated because of solidification of Kapha by Ruksha Guna of Vata. This is what we understand in Ayurveda. And probably this Vata and Kaphahara action of this particular the combination probably helps in relieving this. This is one of the examples. Just say in this way, we can analyze the action of this particular Gokshuradi Guggulu in many conditions. So this is in brief about the pharmaceutical and pharmacological aspects of this particular formulation, wonderful formulation called as Gokshuradi Guggulu. And the therapeutic activity of that will be probably discussed by my friend, Dr. Manjunath Adiga. Thank you very much for your patient listening. Hope the slides were visible and you could appreciate the video well. And thank you for patient listening. Thank you very much.
Thank you. Thank you, Dr. Sharma. Thank you for taking us so swiftly into the fine details, including the purification steps. Please stay with us. There'll be questions from the audience. But before we move to Dr. Manjunath, we're delighted to have Professor Nandwani joining us from Punjab. Ashok ji, Nandwani ji, namaskar ji. Namaskar ji. We are very, very fortunate to have you here with us today, ji. Aapka shayad, as Harish ji said, you were one of his great motivators, and you insisted that he should consider how to do this integration between the modern systems and the ancient systems, and particularly the use of modern diagnostic techniques and treatment with Ayurveda. We would love to have a few words from you, sir, just to connect this complex formulation.
Thank you.
And how we will take it forward. Thank you again for being with us.
Should I talk about the integration first?
Very briefly, sir, and then we'll go to the next one and we'll come back to you.
Okay. My honorable personalities on the board, my students, and especially I am thankful to all of you and the student category, my patients also who enabled me to be to refresh my knowledge time and again. Once you are in a teaching profession, you have to continue with the reading till the end. Otherwise, it's very difficult to exist as a teacher. To be a clinician was a boon for me while sitting in OPD and dealing clinically with the students as well as with the patients. I'm thankful to the patients also who believed in me and allowed me to work with them. I had a couple of things in my mind for this. The first is, once we talk of integration, is it a mixture we are thinking? Is it a combination we are thinking? Is it a amalgamation we are thinking? Or it's an alliance and finally going to be fusion and assimilation of the different pathies existing in the society? It's a big question. And this is the main place where the common opinion is not coming up, how to move with these people. If you think in detail, and if we go backward, there are two things which our forefathers they worked. First is it's a health, arogya. It's a physical well-being, physical health as well as the mental health. Second is the long life, what we call it as a dirghayu. These are the two aims which every field, every person, every pathy is working. So I had in this mind a couple of days. I have seen, so we have seen it so many times. But if you see any patient or even a beggar or a person sitting in a street, though he has a lot of morbidities, he is unable to earn anything, but even then he doesn't want to lose his life and he wants a healthy and long life. Why? This is a big question mark. Though he is not having in his with him neither the health nor the food. Similarly, if we see around approximately 5,000 years back, the Ayurveda came into existence as the previous literatures they show. They had again these two things in their mind for which they worked so many years, and the things they established at that time, they are prevalent in every pathy. Then why there is a hesitancy to work for these things? I could not understand. Similarly, at that time, I was just going through a book and the previous literature also, in their areas, there was an Aristotle, Honorable Aristotle. He also worked on the same principles at that time, who is considered as a father of biology, physics, chemistry. But even then, he worked on the same 5 principles on which the Ayurveda works. The basic principle, the core principles remained the same. If we go to the other pathies like Urinary, like Siddha, like similarly, the bit older or of the same routine is of duration is of our Chinese pathy. They are also working on the same principles. So what I want to convey is, if our ultimate aim of everybody is arogya or health, physical or mental, and long life, what we call it as a dirghayu, I think there should not be any hesitancy in integration and all that. But the only thing was, and you see the beauty of it, I just went through a couple of the basic principles of Ayurveda and their books available there. They had their boundaries also. If we talk of the first person who worked on it was Dhanvantari. The second man at that time who worked on it was Atre. Dhanvantari worked on surgical aspects. Then it was carried on by Sushruta. Then the second person who worked on in medicine was the Atre, and third was with the pharmacological preparations and Bhagbhata. Now the question is, there are two things to think about this. The one is, where is the fear factor for integration? That's the main thing. And what I feel is, there is either it's a political compulsion, it's a pharmacological compulsion, it's a businessman compulsion, or it is a need of the hour, or it's going to be now a difficult time for all of us to exist and to have this. We have seen previously a couple of, say 2-3 years back, we faced the COVID-19. So at that time also, the handicap of each and every person, the limitation of each and every person, they came into play, though we claimed a lot about it. And even at that time, the integration of the various pathies or various styles, they should have been taken deeply at that time. And though the certain establishments were there, but it needs an exact pinpoint where the particular preparation is going to hit the pathophysiological or physiological areas where we can work, and with our own limitations. I think there should not be any hesitancy in that. So though the loss of sovereignty is the main issue with each and every pathy, or there is a fear of assimilation of the different pathies, or there's going to be a business droppings, or there could be a mixing of the culture giving rise to a new culture at that time. So calculating all these things, the loss of individuality for the welfare of the society has nothing to say about this. So what I want to convey is the medical line has should not have any limitations in working with these. A single umbrella can be fruitful, but if you try to discard the people, they had been using say herbal remedies or something like this, it will not be right. Now, in the same time, now I just place one thing in front of you. If you say kirkura, lomba or haldi is our own Ayurvedic thing, and you take the curcumin out of it and you use it and you say it's now a modern thing, it's not an Ayurvedic thing, it's not acceptable. How can you take that? If we go on those lines, then a person working in X-ray is now has come up with the ultrasonography, then they have come up with the CTs, then they have come up with MRI, and now PET scan. Now a person doing PET scan, how he can neglect the person who was previously an only X-ray expert? So parents, grandparents, great-grandparents, great-grandparents, and similarly the other forefathers, they bowed a seed which ultimately flourished into a tree. And it has come up like this. How can you expect how a flower can say that there is no tree? So in that way, what yes, the existence of flower itself is an indication that there was a tree. So the flower can go to any legal person, can give any comments that there is nothing like a tree, then his value is nothing. So what I want to convey, there could be shortcomings. Our way of explanation at that time or in the coming times could have been different according to the languages, the modalities, the sources of the sources available at that time. They could have been different, and they are explained in that way. Now, if we start, giving these shlokas and Sanskrit and these things to the patients, it's not going to work. If they will try to do it, even that is not going to work. So what I want is the integration is going to be a need of the hour, a need of the society at that time, but irrespective of the egos and everything. So ultimately, the two things they come in the forefront is you are to be healthy, you have to lead a healthy and long life. The modus can be any.
So stay with us. We will come back to this after the second speaker, sir, because there's a very important question here. You were principal of a very prestigious Ayurveda college in Amritsar in Punjab. You were also the superintendent of the big hospital there. And we want to hear from you how we can bring this, but we will wait for your comments after the second speaker who is here with us. Welcome, Manjunathji. Namaskar. Manjunathji, thank you for joining us from Bangalore. Again, you come from an institution that runs a large number of educational establishments across Karnataka, just like the team that runs the SDM group of institutions. We're very fortunate to have you here with us. And for those who are here, the listeners who are here with us online and here with us today, I just want to, it's a bit of a warning here because Manjunathji is going to take us into the depths of Ayurveda, and he is going to show us a frightening amount of Sanskritam here. And this will connect us with the question that Ashok ji just mentioned about the Sanskrit verses and how do we accommodate that in contemporary in contemporary needs. Anyway, the floor is yours, and we'll come back to this, Professor Manjunath. Thank you for joining us. Again, perhaps there is this the usual question, what brought you into Ayurveda very swiftly before you start? Thank you, Ji.
Yeah, hope my screen has been
visible. Thank you. Yes.
Yeah. Namaste to all. Dr. Madanji and Dr. Govind Sharma and all the stakeholders of and Tatast. When it comes to my orientation to join as an Ayurveda is of, yes, I seen my family members who has been practicing so significantly with respect to Ayurvedic principles. That is one context. Another one is of my father, brother had an issue of some viral infection, which has been, afterwards I could able to know that at the age of 15 when I've been there, he was been having an issue of the herpes zoster, erysipelas as such. And when it comes to a modern perspective, they commented that you take some medicine and it is going to heal you. But the guy has taken the intervention and it has not worked actually. It has been spreaded. I'm not telling that the scope of other system of medicine has been limited, but in this context, it has been increased, and that particularly it has been happened at the phase. So the guy was been very frightened, and we have been also been worried. At that moment, I don't have that much amount of an intellectual. And we got a guy which has been near to my native, been named as a native person who used to treat these type of skin disorders. What he has done is, it is a very surprising component. What he has done is, he has told to get some, he has got some medicine, which is like a root. And what he has told is, you just rub it up on milk and on a stone and apply at the level of area. And another thing is on a copper vessel. He has taken a copper vessel, I still remember. And the one male child, I had a privilege of doing that one, a male child who's supposed to be getting the water from a well, and he has to fill the so-called copper vessel, and it should not be touched to the ground. And that is to be filled on and often. Same thing on and often being sprinkled on the patient, and the same thing is being given internal. So this was the part I had an exercise of doing this component. And still I remember this was been within 3 to 5 days, completely the lesion has been changed off. So it is very surprising component. Afterwards, I could able to understand what the drug was. See, he was been most of the times the people, they hide their medicinal properties or their medicine as such. But when I've been got an idea, it is in Canada, it has been called as in Keplahu. I think Govind Sharma sir will be knowing this one. And Keplahu here refers to the Ixora cochineae. So Ixora cochineae is a variety which has been mostly available in southern part of India. And the color of the flower is been red. And see the relevancy, the red is been relates to Pitta. And red is a flower which is being offered to a Nagas. Nagas here refers to the Nagadevata as a context. And that root was being used as the one which is being rubbed on in milk, and that is being used. So this is one of the contexts. And if we have been going through the Ixora as a property, the root, what are we telling? It is mostly of in Kashaya rasa. It is Kashaya here refers to the astringent. And another thing is it is best for Kashaya Tikta Madura as a one. So Tikta rasa, that is bitter taste, and the astringent taste are been having a significant impact on this Pitta. And as you know that the erysipelas or this herpes has a Pitta Pradhana, which is having a very significant spreading nature and significantly burning sensation, where the nerve roots are being involved, inflamed as such. So this is one of the part, yes, probably it has contributed me to come in this direction.
Thank you so much for sharing this wonderful story. The presentation is the floor is all yours, sir. If you wanted to maximize the screen so that we can see the entire slide, then that will be wonderful. If you put it to presentation mode, and the floor is yours.
Can you just comment me how much time I can spare on this floor?
Be as brief as possible, because we are 90 minutes. To have so many people on the platform is a challenge, but we want to learn from you. And we want to learn from you, particularly the challenges of Sanskrit and why we still need to respect Sanskrit.
First of all, I'm sorry that I'm just mentioning the most of the Sanskrit versions over here. What I've been felt is of probably we may not get a very significant coin words or a similar words with respect to English as a term. So that is why I just felt that I just keep the whole content as it is. And so that wherever it has been possible, I just narrate the description better. So as I'm telling that I'm privileged to listen to Dr. Govind Sharma because I was one of the colleagues for him in an SDM Hassan. I'll be touching only the therapeutic aspect rather than the pharmacological component. See, I've just highlighted one component. Let's read it out. He tells that Hanyat Prameham Kruchram Pradaram Mutra Gatam Vatasram Vata Rogasha Shukra Dosham Tata Ashmarim, as a word it's been mentioned over. So he tells that Prameham Kruchram Cha. So the Prameha here refers to all these spectrum of diabetes are being told Kruchram, which has been difficult to cure. So obviously, by default, the author takes a chance of telling that the Prameha is in one disease which is not easy to cure, and it comes under the banner of an Yapya Vyadhi, where he tells that Patyabhyasa Viparina. So the person who is having a lifespan, how much extent it has been there, he could able to live that much extent. Once he follows, the only clause is of he has to follow the Patya and Apatya. That is the right type of food and the activity. So obviously that matters a lot over here. So along with that, the intervention, what he has told as Prameya Kruchram as the Gokshuradi Guggul. Pradara is a spectrum of the menorrhagia or menorrhagia as a part. A part of dysmenorrhea also comes into that category. Mutra Gatagum as a one, there is an aghata, there is an impact on the so-called mutra. We'll see that part. Vatasram as a word, it is a Vata Rakta spectrum. So there is.
Dr. Manjunath, we have lost you. Pallaviji, namaskar. Pallaviji, namaskar.
Namaste ji.
We have lost Dr. Manjunath. We've lost his connection. What are we doing now? Shall we, while we wait for Dr. Manjunath, perhaps we can continue.
No, this is very interesting. Gokshuradi Guggul, when combined with different anupan, it gives a different pharmacological action. So he was just speaking about Pradar is menorrhagia.
While we wait for Pallaviji, while we wait for Manjunath ji to join, perhaps we can go to Ashok ji once again. Ashok ji,
yeah.
Namaskar ji.
That would be nice, yeah.
Ashok ji, the question here is how you have very correctly said that there should not be a difficulty in integrating systems of medicine. And, you know, on one hand, the purists in Ayurveda say, sorry, we cannot combine our science with any of the other sciences, versus the middle ground, which says, you know, we can bring in the best technologies, like you said about different scanning technologies. And we have on the right-hand side, the other extreme people who say Ayurveda is all nonsense. Now, how do we make this dialogue happen? I mean, a senior person like you, I'm sure you have faced this on a daily basis and you continue to face this. Please enlighten us, sir.
Thank you. Thank you very much. Let us keep one thing in mind. First, human body is same, was same, going to be the same. The people who started working on it, they may be different. Their modalities, their technicalities, their way of conversation had been different as per the availability that time. It's very clear. As the things are going on, I'm just putting you one question. We are having Honorable Anup Jalota ji with us. His way of singing and giving peace to the soul, is it now a remote thing, or the people now doing the pop and rock and everything whatsoever they are doing now? So how can you disregard or how can you obsolete the people with the personalities like Mr. Anup Jalota and so on? But they forget that they have come up through the same source the same main sitar and everything from which they are now encashing it. But they can't parallel it. But we can't obsolete these people, number one. Number two, if there is a main fear of what I was saying previously, okay, there can be a loss of individuality. That can be fear in both of the communities. There can be a loss of severity, or there is a fear of assimilation and fusion among the people, among the things in which it's not possible. Then there is one way. They say, we say that I have a beautiful beloved. I'll kiss my own beloved. Let them kiss their own beloved. But this thing should be very clearly known that the human body and the battlefield is the same on which we are working. So whatever suits the people or whatever things they are going on, if the battlefield is same, the approach to fight the disease and to prolong the life can be different. You can have multiple.
Ashokji, thank you. I'm going to interrupt you here. There was because I can see Manjunathji is back. His connection is back online now. The comment that you made is an interesting one. Chairman Mao, it seems, once said, it doesn't matter what color the cat as long as it catches the mice. That is what matters here. Manjunathji, welcome back. We've lost your connection now. In the process, you have also lost the total amount of time available for you. So the challenge now is to speed along. You have about 7 minutes left.
Great. So I was been telling about with respect to the prameha and this as a description. I'm not going to detail this part of ingredients as such. See, I'll just concentrate on these karmas of the ingredients. Gokshura being considered as an and rasayana, and when it comes to maricha, Deepana and Pramati here refers to which has an capability of carrying the content to an extreme level or the deepest level or the targeted areas, what it's been there. People is Deepana Vrishya as such and Haritaki Vivitaki as a part in together. If you go to observe the... So, am I audible, sir?
Yes, we can hear you, but I request only the speaker to be... Thank you. Please continue, Manjunathji.
Yeah. So if you're going to see the ingredients, if you're going to see the compound formulations, most of them are having a trifala and trichoto as a context, which is a part and parcel as such. So here, Gokshuradi Guggul, as per the Ayurvedic perspective, the indication are being very, very specific. He's not telling about other context as such. But meanwhile, we are being using in different contexts. But in that perspective, there is the specific research are to be done. I'll go further. So here he tells that Hanya Prameha Krichra Masan, Krichra Prameha, difficult to treat, and Pradara, Mutragata, Vatarakta, and the Shukra Dosha and Ashmari. Okay. So why the Prameha? See, by default, it has been mentioned that the Prameha is Krichra Sadhya, as it is a Tridosha Prakopa will be there. There is all the three humors are being involved in manifesting that disease, but predominantly it is the Kapha being involved in that manifestation. Here he tells that Bahudravaha Sleshma Dosha Vishesha, that is Dosha Vishesha is one which is very, very predominant. That is Dravaha. That is mostly the liquid component, because as we have around 70% of the water being available at the lower body, that humors are going to be get vitiated in terms of Meda. So mostly he is telling about the larger amount of kleda, the larger amount of snigdha guna, larger amount of, I'm telling about the samprati or the manifestation of this disease, mostly about the kleda guna, or mostly about the unctuousness, or mostly about the liquidity at the level of body, which is contributing significantly in causing the disease called as prameha or the so-called diabetes, a spectrum of that. Among them, the so-called shonita has been mentioned, the rakta. So here, the association of rakta comes in the later period, where commonly we evaluate the blood sugar, but we don't evaluate the urine sugar. As per the description, prameha is a definition tells that there is an expression should be there at the level of urine. Then only we can consider that it is an prameha as a context. So here, the mutra is being involved, where there is a contribution of more drava guna and meda being involved over here. So here, basti gatam pradushya as a word is been mentioned. That basti here refers to commonly in a coin term for the basti is of a urinary bladder. But in here, the basti here refers to the whole urogenital system to be taken into an account. That is, the more amount of clether, the more amount of liquidity which has been available at the level of body, being goes towards the bladder area, and from there is an escaping of the content. So you may take the consideration of an albuminuria, or you may consider the relevance of the what's this, hyperglycemia. So all these things are being an expression of the pathology with perspective of an urine. So here he tells that what is the chikitsa over here? What is the treatment for the samprapti or this what's this prameha is of virukshana. Virukshana is drying of that content. See, if you've been having a larger quantity of water, one option is of we have to remove that. So we have to remove that content. If it is very less quantity of water, we can drain. So for an example, you can put some water, you can put some mud, and you can dry it up that content. But here, when the larger quantity of water molecules or the vitiated kapha is been available, we have an option of eliminating that dosha by means of a mutra. That is, if you're going to observe, three malas are been available. There is sveda, that is sweating, and this mala is of stool, and that purisha as a part. The next one is of mutra. So that is, the mutra is having a more amount of capability to carry the good amount of liquidity outside. So that is the media where we can encourage that dosha to eliminate. So that is why the virukshana can be done by means of Gokshuradi Guggul. In which categories? See, obviously this has been applicable for an kaphaja prameha, that is where there is a more amount of pre-diabetic expression, where there is a higher level of cholesterol, and the person has been sedentary in activities, not doing much. So due to that type of spectrum of reasons, the disease which has been manifested are being targeted by means of this medicine. So going further, how the Gokshuradi Guggul acts as the elimination of clether, virukshana as a word, the rate of metabolism is being increased by means of deepanapachana, the ingredients which are being available, and reducing the kapha and meda, because the meda is one of the major culprit which is going to be get influenced by the kapha as a context. Okay, so going further, see the triple terrestris has significantly reduced the level of serum glucose, serum triglycerides, serum cholesterol, while the SOD activity are found to be increased in alloxyl-induced diabetic mice. So this was the ideology. So Gokshuradi Guggul has been helpful for the people or the patients who are been having a more amount of kapha. Kapha here refers to the more amount of clether, where it is being seen, the unctuousness is being seen more with perspective of in blood, that is the triglycerides. So Gokshuradi Guggul has a very good benefit with perspective of dyslipidemic expressions of diabetes mellitus. But I would like to quote the word from a previous presentation. It matters a lot what type of shodhana being used, where the Guggulu shodhana is being done by means of gomutra, which has a more capability of scraping or cleaning the things better when compared to the other varieties of when it has been used as a kshira. So, or when it's been used as the water. So this matters a lot with perspective, this context. Okay, what's about the Mutra Gata and Mutra Krichra? So Mutra Gata as a word is being Mutra Avarodha. Wherever there is an Avarodha, obviously with respect to urogenital system, the Gokshuradi Guggul holds true. And what is the difference with respect to the Mutra Krichra and Mutra Gata as such? See, the Mutra Krichra is Krichram Atishayitam Ishad Vibandha. There is a little obstruction, but the person feels more difficulty to urinate, but there is no blockage, there is no obstruction as such. But when it comes to Mutra Gata, it is about the Vibandha. It is about mostly the blockage is being more, person will be having a less or difficulty in passing the urine. So there is a scanty urine you can consider with respect to the Mutra Gata as a context. Okay, there are different varieties. There are classification or the types of Mutra Gatas are been available. So I will be detailing on this part, where the Mutra Gata is Mutra Avarodha, there is a retention. So the total of 13 varieties are there, and the Mutra Sada is suppression, where there is no secretion as such. So when it comes to Gokshuradi Guggul, wherever there is a retention, so he tells that when there is an Avarodha, you need to give a Mutra Virajaniya Dravyas. The Virajaniya here refers to make that thing to flow off. Same thing with respect to what is Prameha. And when it comes to Mutra Gata, the same pathology runs. So obviously in the category of Mutra Avarodha, the retention categories, the Gokshuradi Guggul works better. Okay, when it comes to the Ashmari, as it has been told previously, there is an Avarodha, there is a blockage, which is causing an issue. And obviously the quantity of the urine is also been less, and there is the so-called block has been causing due to see, the simple example is of if you're going to take up a pot, And in that one, if you're going to fill the water for a longer duration, and then automatically there will be a layer going to form up. So in the same way, there is a good amount of retention of the urine and the hyper concentration of the urine which is being there, which will going to result in the presentation of an calculi and avaroda. So in that category, so obviously the ashmari is being used. So in that category, sorry, in that category, Gokshuradi Guggul is being used. But only one thing is the Gokshura is not having a breaking property. It is not an ashmarigna. It is not going to break the ashmari. So that is why if you have been seeing the property, if you have been seeing the references, it has been mentioned that the Pashana Veda is being used as a part of, in the different varieties of formulations, Gokshura is one of the ingredients. If I'm being not wrong, there is one article I could able to refer over here. That is the Agarwal tested the activity of the Gokshura on the nucleation and the growth of calcium oxalate crystals as well as oxalate induced cell injury. So obviously it has some amount of some scope of impacting on this calcium oxalate crystals, but it is not very significantly impacting as a Gokshuradi Guggulu with the perspective of an ashmari. Probably we need to have another formulations to intervene along with this context to have the better benefit. Okay, when it comes to a pradara, I'm just touching this around the 4 varieties have been available. That is Vataja, Vata predominant, Pittaja as a one, Kaphaja, and the Sannipataja. So if you have been going through the Vataja category, he tells that Tivra Vedana is being mentioned. That is a severe type of pain. That is, the person will be having a bleeding, and along with that, there is a more pain. And when it comes to Kaphaja, you just observe that is Manda Rujakaram and Sleshmanam, and moreover, it is the slimy as such. When it comes to Sannipataja, an infectious, where the Daurgandham, Pichilam, Pitam. So that Daurgandha is the bad smell. So somewhere as it has little scope with respect to the Vataja category of an pradara, rather it has a very good effect, it has a very good benefit, therapeutic point as in Kaphaja category where there is a Manda Ruja as a point, because Mutrala as an expression is being seen, and Sannipataja as a category where there is an Daurgandhyam is being there. There is because, see, there is a mud is being there, automatically there is a possibility of having a worms to manifest. So that is why in the context of infectious category, we need to have some local interventions along with this medicine will going to give a benefit. So there I could able to drag some, am I audible, sir?
Manjunaji, I just wanted to say we are running out of time. Now, I will leave it to you to improvise because your presentation is extremely impressive. I will leave it to you to draw it to a close. You have
great. I'll do that.
2 minutes more. Thank you.
Just
apologies for this.
When it comes to an shukra.
Can I have a minute, sir?
Yes, certainly. We'll come to you, sir. We'll come to you.
Okay, sir.
Yeah. So
please.
I'll just drag a little faster. Shukra as a dosha, that is the when
Manjunaji, if I'm going to interrupt you here, apologies for this. What I feel will be more beneficial for us, you have given us a taste for where and how we should approach this problem, the fine details. This is almost what we would say a PhD level course that you're running here. So I'm going to stop you here and thank you so much for sharing. And stay with us because we are limited for time. If you could stop sharing your screen, then I want to bring. I think Professor Ashok wants to say something, and Ashokji, namaskar.
Namaskar.
Now, Ashokji, what you have seen in this presentation is the essential need for mastering Sanskrit, because you have to read those texts. You have to understand what is written in the text and between the lines also. So this requires a great mastery, and what Manjunaji is showing is just that mastery. And it's wonderful that we will have it always in India. But where do we make this happen in that integrative medicine space, sir?
Look, there are two things again. What I want to say is about the integration is, if we integrate on those lines with these things, we can have a very elephant ride on every problem. That's the main thing. You can see it from the top. And it can lead to a very economical and affordable way of healthcare, which is now very costly these days at each and every place. If especially we talk of the otherpathy, not in ours, it's also going to be costly now because the things are going very costly these days now. If we can provide affordable and quality healthcare to the ailing community. Second is we can plan the effective treatments disease-wise very easily. But the question is, and thirdly, if we go with the integration in that place, the local preparations, local medicines of each and every area can come into the picture, and the quality as well as the cost of the treatment will go very less. And that's going to be a boon to the ailing community. The next is, the other main headache question is, why an Ayurvedist should explain the things in allopathic language? Why so? It's not possible. If you explain, if a coin has got a head and a chain, how can be the chain on both the sides? How can be a head on both the sides? Then that coin is of no use. So let them run in their own way and sit very honestly, very clearly with the clinical experiences and give a clear view. These are the places we can do very well. These are the places we can't give you the boost in that way. In say fistula and piles, our Shar Sutra can go surgically very well. Similarly, there are other surgical methods as they were explaining. If there is a stone is impacted one, Gokshuradi Guggul is not going to do anything. If it has got infected at the PUJ junction, or it has got bigger in size, it's risky to play with the life of a patient. But though our books, they say that we have got a couple of things which cause lithotripsy, and they are lithotriptic also, and we can break it. People had been breaking it in the past, but still those things are only isolated at certain places. So what I want to convey is, for integration, a very honest, practical experiences, they are required to be shared, and we can move in our own boats very comfortably for the ailing community. So with this,
thank you.
Yes.
Thank you so much for being with us today. But we are very fortunate to have another one of your students, Dr. Jagjeevan Singh, who is a 2005 student of yours, batch student of yours, who is currently there in Toronto in Brampton University. He sends his regards to you. And the second thing, in terms of where this integration might happen, there have been questions coming about the significance of the use of Gomutra for purification. And this is one example of how integration is happening in Punjab. This is from the Department of Pharmacology at the Government Medical College in Amritsar and the Department of Medicine at Guru Nanak Dev Hospital in Amritsar. And it's a wonderful paper. I'll keep it up here for a second for those who, for recording this. You will see how in great detail they have explained so many properties of this cow urine and how it is used as an antimicrobial, how it has certain properties, and how it can be used for perhaps as a fungicide, biofungicide. These are all activities that are used in a very clever way when we purify material, complex materials like the oleo-resin gum that we are using. I want to say apologies to Manjunaji.
Yeah.
We will find another occasion where we will come together to discuss in great detail about what you have shared with us today. And thank you, Ashokji, for being with us. And thanks to Dr. Sharma. I leave this to Pallaviji. Pallaviji, namaskar.
Thank you, Dr. Madan. I really wished express my apologies to Dr. Manjunathji. You had a terrible command on your presentation, but you know, we are all time bound, so you must forgive us. So with this, I thank today everybody who were our special guest today, Anup Jalota-ji, who really took his time out from his running concert and came and honored us, all of us. Thank you. And our special guest, Professor Ashok Nanwani-ji, who are giving his expert comments on this podium. Our expert speakers, Dr. Govind Sharma and Professor Manjunath, excellent presentation and a good feedback. Thank you so much. My sincere thanks to Tathastu. Today, Georgie Bhallaji was here, and it was because of him. I think we had Anup Jalota and Dr. Harish Verma. Thank you very much. And my special thanks to our collaborators from UK, US, and Canada. Canada India Foundation, Satish ji, thank you for being so instrumental, and our Consulate General of India, Toronto, from Canada again, and Kappa Association, the Ayurvedic Association from Canada, and Canadian College of Ayurveda and Yoga. Thank you very much. Our American collaborators, American Association of Ayurvedic Practitioners and Union of Midwest from Chicago. Some of the members are missing today, but they are always here to grace us with their presence. And also our European members, European Association of Ayurveda and Association of Ayurvedic Academy, Y Media, Pravasi Television, and all our members here today, our viewers, thank you so much. Next, our session will be on 14th of May. It will be on, the topic will be Khadir Adi Arishta. So looking forward for all of you to join us again. Thank you very much for all your valuable time. Thank you. Dhanyavad.